Most people expect pregnancy to change their bodies in obvious ways. A growing belly, sore feet, strange cravings, darker skin in places no one warned you about. By the time the final trimester arrives, most women feel like they've already seen it all. So when a small change shows up, something subtle and quiet, it rarely sets off alarm bells right away. That's exactly how this story begins. A woman in her late 20s, otherwise healthy, going through a completely normal pregnancy, notices something a little unusual in the last few months before delivery. It's this small, warty-looking growth on the areola of one breast. It's sitting close to the nipple, a bit darker than the rest of the skin, and slightly raised. Not huge, not shocking, just enough to catch your eye when you're getting dressed or stepping out of the shower. At first glance, it really doesn't seem like a big deal at all. It doesn't hurt. There's no pain, no discomfort, nothing. It's not bleeding, it's not oozing, there's no redness around it, no swelling, no fever, nothing that sets off alarm bells. It's just there. And honestly, during pregnancy, that almost feels normal. So many strange little changes happen that you start accepting things without a second thought. And let's be real, hormones during pregnancy are on a whole different level. They affect everything, especially the skin. For a lot of women, the areola naturally gets darker as the body prepares for breastfeeding. The texture of the skin changes too, sometimes becoming rougher or bumpier than before. Tiny little bumps can show up out of nowhere and then disappear just as quickly. Skin tags are also incredibly common, especially in areas where the skin stretches or rubs. So when something like this appears, the mind automatically tries to rationalize it. It's probably hormonal. Just another pregnancy-related change. Nothing serious. With everything else going on in the body, a small, painless bump doesn't feel urgent or scary. It blends right into the long list of weird but usually harmless things pregnancy does, making it easy to ignore and move on. But here's the thing, the body works on its own timeline, not ours. And as the weeks go by, that little growth doesn't just vanish the way you might expect it to. It also doesn't suddenly blow up overnight or do anything dramatic. Instead, it changes slowly, quietly, almost sneakily. Little by little, it starts getting bigger, just enough that you notice it more often. At some point, you realize the surface doesn't look as smooth as it did before. It starts to look a bit wrinkled, a bit uneven. When you touch it, it feels firmer too. Not painful in a sharp or scary way, but different, noticeable. The kind of thing you're aware of even when you're not actively thinking about it. Still, with late pregnancy bringing exhaustion, back pain, swelling, and 100 other things to deal with, it stays pretty low on the worry list. There's always something else that feels more urgent. Then everything changes once breastfeeding begins. Milk comes in, and suddenly the breasts feel fuller, heavier, and way more sensitive than before. Everything is tender, everything feels new, and that's when the growth starts making its presence known in a whole new way. Feeding becomes uncomfortable. Certain nursing positions just don't feel right anymore. The skin around the areola feels sore, almost irritated, and that growth keeps rubbing against the baby's mouth during feeding. Breastfeeding already has a learning curve. There's the latch, the positioning, the soreness, the constant adjustments. It's not always as effortless as people make it sound. Now, on top of all that, there's this extra source of discomfort that won't let you forget it's there. What once felt like a harmless little change suddenly becomes something you're very aware of, especially during those long, frequent feeding sessions. At this point, it's no longer just one of those, that's weird things. It's not cosmetic anymore. It's not just about curiosity. Now it's practical, it's affecting feeding, and once something starts interfering with something as important as feeding your baby, the whole situation changes. That's when it stops being easy to ignore and starts feeling like something that actually needs attention. So she decides to get it checked out. During the exam, the doctors take a really close look, and this is where it gets interesting. They see a single dark growth on the areola sitting right next to the nipple. It's irregular in shape, not smooth like you'd expect a typical skin tag to be. The surface looks wrinkled, almost folded, and when they touch it, it feels firm instead of soft. There's even a small central cleft, like a tiny indentation in the middle, which makes it look more structured and organized than a simple wart. There's no redness, no signs of infection, no obvious inflammation, but at the same time, it doesn't neatly fit into any familiar category. It's not clearly one thing or another, and that alone raises eyebrows. Then comes the moment that changes the entire conversation. With gentle pressure, milk starts coming out, not from the nipple itself, but from tiny openings at the base of the growth. And that's the part that immediately raises questions. Because milk ducts don't normally run through random skin growths. They're not supposed to do that. That one observation instantly shifts this from a minor skin issue to something far more unusual and complex. And now everyone in the room knows this isn't as simple as it first appeared. Even with that surprising discovery, the rest of the exam is actually pretty reassuring. The doctors check carefully, and there are no other lumps anywhere in the breast. The surrounding tissue feels completely normal. The lymph nodes in the armpit aren't swollen or enlarged, which is always a good sign. There's no redness, no warmth, no swelling, no strange discharge, nothing that points toward an infection. The other breast is checked too, and it's totally normal, with no similar changes at all. To be safe, they don't stop there. Standard tests are done, just to cover all the bases. Blood work comes back normal. Imaging doesn't show any suspicious masses hiding deeper in the breast. The breast discharge is analyzed, and that looks normal too. There's nothing suggesting cancer, nothing pointing to an infection, and no signs of some underlying systemic condition. On paper, everything looks fine, and yet the growth is still there. It's still painful, it's still rubbing during feeds, and it's still making breastfeeding harder than it already is. That's where the frustration starts to creep in. Because when all the tests say normal, but the problem hasn't gone away, the uncertainty becomes the real issue. At that point, just watching and waiting doesn't really make sense anymore. This thing doesn't fit neatly into a known diagnosis, and it's actively affecting daily life. So the decision is made to remove it surgically. Not because anyone is panicking, but because it's necessary. The goal is simple: relieve the pain, make breastfeeding comfortable again, and finally get a clear answer about what this growth actually is. The procedure itself is actually pretty simple. It's done under local anesthesia, so there's no major surgery involved. The doctors are very careful the whole time, making sure the natural shape and function of the breast are preserved. The lesion is removed completely, and the area is closed up neatly, keeping the contour of the areola and nipple intact. There are no complications, and recovery starts right away. But here's the interesting part. The real answers don't come from the surgery itself. They come later, under the microscope. The tissue that was removed is sent off for histological examination. And that's where things take an unexpected turn. Instead of seeing the usual features you'd expect from a wart, a mole, or some common benign skin growth, the pathologist noticed something very specific. The lesion contains skin structures, smooth muscle fibers, and actual milk ducts, all mixed together. And that's a big deal, because those are the same building blocks found in normal nipple tissue. That combination is what seals the diagnosis: intra-areolar polythelia, also known as nipple dichotomy. In simple terms, this growth wasn't really a random skin issue at all. It was actually a partial extra nipple that developed within the areola itself. And that's what makes this case so unusual. Most extra nipples show up along the embryonic milk line, which runs from the armpit down toward the groin. This one didn't follow the rules. It formed exactly where it was found, right inside the areola, which is why it was so easy to miss and so hard to recognize at first. This condition is actually something a person is born with. It's congenital. That means it's been there since birth, hiding in plain sight. The reason it went unnoticed for so long is simple. The tissue was incomplete and inactive. It didn't grow. It didn't produce milk. It didn't hurt. It blended in so well with the surrounding skin that there was never any reason to suspect anything unusual. For decades, it was just there, quietly doing nothing. Then pregnancy happened, and that's when everything changed. Pregnancy hormones are incredibly powerful, and they don't pick and choose. Estrogen and progesterone start stimulating breast growth, prolactin gets the body ready for milk production, and any tissue that can respond to those hormones will respond. In this case, the little dormant accessory nipple tissue woke up. It acted just like normal nipple tissue. It grew, it became sensitive, it developed structure, and it even connected to milk ducts. That's why milk could be expressed from it, and why feeding suddenly became uncomfortable. It wasn't a malfunction. It wasn't the body doing something wrong. It was just following instructions that had been written long before birth. After surgery, everything goes smoothly. The wound heals nicely. Breastfeeding continues without problems, and milk production stays completely normal. Follow-up visits show no recurrence, no complications, and the breast keeps its natural appearance and function. Life goes back to normal, and what once caused worry becomes just another interesting story about how wonderfully complex the human body can be. What makes this case really interesting isn't just how rare it is, it's how easily it could have been misdiagnosed. At first glance, it could look like a wart, a mole, or even a benign tumor. Those would all be reasonable guesses if you were just going by appearance. But without sending the tissue for a proper histological examination, the true nature of the lesion would never have been uncovered. And that's exactly why cases like this are so valuable in medical education. They remind doctors and students alike to look beyond the obvious, to question assumptions, and to dig a little deeper when something doesn't quite fit. This case also shows something pregnancy does in a really remarkable way. Pregnancy has this way of revealing things. It doesn't always create new problems. Sometimes it just amplifies what's already there. It brings hidden tissues into the spotlight and turns structures that were silent and dormant into active ones. In a way, pregnancy is like a spotlight on the body, exposing little surprises that were quietly waiting in the background all along. What was once invisible suddenly demands attention, and that's exactly what happened here. In the end, what at first seemed like a worrying new growth turned out to be nothing dangerous at all. It wasn't a disease, it wasn't an infection, and it certainly wasn't cancer. Instead, it was a rare congenital condition, something she'd actually been born with, that only became noticeable when pregnancy hormones brought it to life. It's a great reminder that the human body doesn't always follow the textbook. Variation is normal, and sometimes what looks unusual is just part of being human. The body isn't always breaking down or malfunctioning. Sometimes it's simply telling a story it's been holding on to for years, quietly waiting for the right moment to show itself. And in this case, pregnancy was that moment, turning a hidden little detail into something noticeable, something real, and ultimately, something fully understandable. It's fascinating, and honestly, it's another example of just how remarkable and complex our bodies really are. And that's the story. Have you ever noticed a weird change during pregnancy or wondered about rare conditions like this? Let me know in the comments below. I'd love to hear your thoughts. And if you found this story as fascinating as I did, don't forget to hit that like button and subscribe for more amazing health stories.